Hello, my name is Eurika and this is my first year in ISM. A few things about me are I'm 18 years old, I don't have any siblings so I'd rather just have a dog. My favorite season is winter, and when I was younger I wanted to become an astronaut because I wanted to travel to space and explore the universe. But now all of a sudden I'm interested in the medical field, so this year I chose to study pediatrics. The first interview I conducted was with Dr. Kumar, and an interesting perspective I heard from him was about how he likes to treat kids because he feels like since they can't talk, it's like a challenging puzzle he has to figure out. And one advice he gave me was to be sympathetic towards parents because they're very sensitive when it comes to their kids. Next, I interviewed Dr. Diana, and an advice she gave me was it's really important to learn time management skills because checking patients isn't the only thing you do when you're a pediatrician. And as far as medical school goes, she thought it was like drinking water out of a fire hose because there's so much to learn in very limited amount of time. But as long as you like to learn and are very persistent with it, you'll probably be successful. Next, I interviewed Dr. Diana's colleague, Miss Mannering. And what she likes about pediatrics is how she gets to build relationship with families because she sees the kids grow up and they come for regular checkups. So it feels like she has so much connection with them. And how you talk to kids depend on their age because if it's like a teenager, then you'd probably want to talk to them more maturely. But if it's like a younger child, then you probably want to ask like, oh, hey, what's your favorite cartoon? Or I like your shirt or something like that. And yeah, so next, Dr. Knapp, she's my mentor this year. And advice she gave me was to be sure of what you want to do because you don't want to waste time on like figuring out if you like something or not. So that's why she also likes ISM because it gives kids opportunity to explore the career they're interested in. And a challenge she had while becoming a pediatrician was the residency part of it because she had to work for 30 hours a week without like stopping, which was kind of hectic. But then after a while she got used to it. Lastly, I interviewed Dr. Stanton. He was a very interesting guy. He was 67 years old and he had over 30 years of pediatric experience. And he also gave me the work proposal idea about how a lot of pediatricians are pressured into what parents think. So a lot of parents feel like their kids need antibiotics, but in reality when they just have a viral infection, which actually isn't cured by antibiotics. So for my work proposal, I was thinking about making a medicine for viral infection, which I told my mentor and she thought it would be very hard to do so I have to think of something else. And it's also very important how you think of your job because when he approaches his patient, he thinks of it like they are his own child. So when you think of it like that, then it varies on how you approach the treatment. And furthermore, when you first start your job, a lot of people don't know what they're doing because even if you're learning in a classroom setting and you have training in residency, it's very different from actually applying it to the real world. So it's okay if you don't know it at first because you will learn as you practice. And for my research, my first topic I researched was child psychology, and this was about how it's very important to form good habits when you're a kid because it's very impactful and it stays with you for a longer period of time because kids are very, they learn things very quickly, so it kind of affects them a lot since they're kids. And next I learned about pediatrics in pharmacy education, which just talked about how pharmacy schools are also incorporating pediatric courses in their curriculum because a very vast knowledge is required to enter the medical field. And similarly, I assumed that pediatrics also has other courses and electives that is outside of the field to create more well-rounded doctors. Next, about neonatal glycemia and neurodevelopmental outcomes is how some kids are born with very low blood glucose level, which affects their vision and also causes slower brain development. And by reading this, it helped me realize how you can't just generalize and categorize the child's health, because even if they do have the same condition, it could vary slightly among the children, which could cause to have like different treatments. So it's very important to keep that in mind. And safety for kids was about how kids are always curious and want to play with everything they see. So it's the adult's responsibility to guide them and protect them, because one small mistake could end up negatively impacting their life forever. And lastly, teen substance abuse was about how a lot of teens actually do drugs and alcohol, but a lot of people aren't. It's a lot more common than people think, and even pediatricians can't detect when a teen is doing like alcohol or drug abuse. And so sometimes, like when the parent is in the room versus the parent not being in the room, creates like a different answer from the child. So it's important to try out different methods to get the honest answer from a patient. So it's for their own good, so it's okay. And this video is about how this girl goes to the doctor to get her blood taken out, but there's no blood coming out because the nurse isn't careful enough, and it ends up hurting the girl a lot. And this just shows how much extra care a child needs compared to an adult, because they're a lot more sensitive. Do I play it? It's not too bad. It's just sad.
It's okay, baby. It's okay. Yes, it's okay. You're a good girl. We gotta try to hold you. I know it's okay, sweetie. Get real straight there. Lisa, you wanna come here and help me hold her?
Yeah, it's very sad. And lastly, my quote is from Oprah Winfrey, which says, "Life is big, so keep reaching." And how I interpret this quote is, it's okay if you like suck at something or like something doesn't work out, because if you keep on like trying to find new things and discover new things, you'll probably find something that's actually meant for you, and you'll probably enjoy it more. So it's okay if you don't know what you want to do now. Thank you.